Carl Plant, or at Carl Plant. I'm a director of a company called BitJam. We're a creative technology company that we get to play with lots of technology and try to bring technology into lots of different settings, such as high schools, the NHS, local authorities, and charities. So we tend to do a lot of work around a whole range of technologies, from hardware, apps, and social media and social software. But my background is actually, I'm a still qualified nurse. I worked in the NHS for 12 years plus, and from the early days of very early MySpace, we tried to use social media, or sort of social networking, to engage with younger people. So we tried to, in the early days back in Staffordshire, tried to use social media to engage some younger people. We tried to look hip, and it's a very sort of some minor successes, some minor learning lessons from the early days of trying to do that. But since then, I've, like a lot of people, stepped out of the NHS because I wanted to work in a range of settings. So I run a company named BitJam. But today, we're here for the Health Camp West Midlands. For those people that don't use Twitter, or maybe have got a Twitter account but maybe are just listening, just following the hashtag today is a great opportunity to find who we all are, what's happening, find some interesting links, and hopefully it'll be a great source of information following today's event. So even if you're new to Twitter, it's great just to follow the hashtag. We've mentioned social media quite a few times this morning, but already more people have said it's more than just social media. So what I want to do is set the scene that what we're talking about here today isn't just about Twitter, isn't just about Facebook. It's actually about the way that technology and the internet has changed. We're actually entering a more socially, social revolution through the technology and through the web. So when we're here talking about this conference, the social web is more than just social media. It's actually social software. So people are using things like Google Docs and Dropbox, Evernote, also Skype, a whole range of different types of technologies, apps, hardware. I've got one of these Nike Fuel Bands. So this measures my movement over a 24-hour period and charts my movement. Well, actually, I can share that online, and I'm in competition with other people to look at how much Nike fuel they're using over a 24-hour period. So actually, lots of technology is becoming more social. It's actually getting people to actually work together and connect together. So even though we may talk a lot about social media today, just bear in mind that actually the web is more social, technology is more social. So it isn't just about Twitter, it isn't just about trying to get people on a Facebook page. It's about, okay, what sort of technologies are people using? Especially those people that maybe haven't got access to the internet, what they do in their daily lives over, they might be going to shopping centres, they might be going into hospitals, where there's technology around them that could be a way of communicating with them. So it's about thinking more than just Twitter and Facebook. But of course, social media is a huge part of this, because social media gives us quite a low-cost way of engaging with people, listening with people, of actually finding out what people are saying, what people are doing. So social media is important. But some of the key points I feel that are available for healthcare around social media and technology and software. It enables networks to form. It enables patient communities to be empowered to help each other and to find support. And that's happening already. Whether the NHS want to try and engage with it or don't want to, it's already happening. So there's actually lots going on, lots of networks being formed. It'd be great for the NHS to be part of that, but it'd be great for the NHS to learn from these communities, because what's happening is we've got like diabetes communities, we've got a whole mass of experts in diabetes that could provide so much useful information for the NHS, for research partners. So the key point here is that actually there's all these networks forming that actually provide some really valuable information and forms of engagement for healthcare providers. what's happening because of technologies and because of the web has become more social, it's altered the way that people learn. So health professionals, patients, carers, they're actually learning together. You don't have to be in the same library to work with a group of people to learn a subject. It's happening over the internet, it's happening in different countries. So we've got these communities forming, these networks forming, and through that people are learning, people are sharing information. So from a healthcare provider, yes, social media and this social web stuff that's going on, it's great for engaging patients and carers, but it's also about actually helping your staff to learn, and your staff to learn more sort of in groups. So I was going to show some examples of the NHS are doing this social media stuff. We can find our own examples. We can actually do that ourselves. But I'll show a couple. However, historically, the NHS have tried to get on board. In some sense, the NHS used social media as an extension of some traditional comms, which in many cases, it didn't really go over well. There's a lot of difference between traditional sort of printed type of comms and press release. Trying to shift that into social media hasn't really sort of gone over quite well. So in some ways, I wouldn't advise doing traditional comms, because what you tend to have then is almost like digital posters saying, eat more, exercise more, do this, do that, do this, and people start filtering that out. People stop listening to that. So entering into social media for the first time, you need to think about, okay, what is it, what we're going to do with this stuff? How are we going to connect with people? Because if not, you end up just broadcasting at people, rather than engaging socially and engaging and connecting with people. You tend to be broadcasting, and people will switch off. What you'll have people who may retweet your stuff, but they're retweeting it because they're thinking that their communities are listening. But what you end up is lots of time and money being spent on communications when only a small amount of people are listening, and very little changes from that. However, there's some really good examples of how healthcare providers are using social media and social technologies. You can find your own way around this, but some of the examples, I mean, we've got the Chelsea and Westminster Foundation Trust. I mean, they've got their trust values, 12 days of Christmas, so they're actually using sort of Twitter as a way of actually getting their message across, and actually having people answering them back, talking to them about their values. So these people aren't afraid to talk about trust values and have people respond to that. Another example, it's not so clear, but this is a service called Scoop It. And basically, the Brighton and Sussex University Hospitals, they're actually curating content that they find from around the web that talk about their hospital. They're actually curating that into one sort of almost like an online newsletter. So they will bring in information from their own communications team, but also they're not afraid to bring in stuff that other people have blogged about their trust. So these people are curating stuff that other people are doing. Another example is the way that the NHS Choices have hired in cartoonists and hired in writers to help them to make engaging social media. So again, it's a health message that they're trying to get across to people, but they're using a creative way of actually creating videos. So this is a cartoons that are arranged topics you see on the right. They recently, a few years ago, they held a competition for cartoonists to come up with, I think, they were given some topics to do cartoons on. This is one of the winners. So they've now commissioned a series of cartoons. So trying to find some ways of using social media, but in a more engaging, more creative way. Okay, so just want to briefly just talk about social learning, because I think this is quite a significant part for the NHS and for healthcare providers to get on board. The sort of technologies that we have allow people to network, allow people from different parts of the UK to connect together online. There's quite a number of Twitter communities that talk about the NHS SM is one of them that talks about social media in the NHS. But these people are connecting together and actually sharing information and actually sharing learning online. So they're sharing and they're collaborating. People nowadays are outside the NHS are using Google Docs, using Evernote, using quite a range of different types of software in a more social context to actually work together. So yes, get on board social media, but think about actually there's more to this sort of social technology that can enhance the workforce. And again, it's actually, by using social media and social technology, we can actually curate and share best practice. So actually we can create a list of bookmarks of all the favourite examples of use of social media, and you can share that with people. Briefly. So there's 4 key behaviours, 4 key factors that I think are worth raising at this point. The first one, social media allows us to be more human. I think somebody mentioned the word human, which I actually put it here. Actually, there's nothing wrong with an NHS trust engaging their communities, but in a more human way, actually bringing in a bit more personalisation within that. So actually, rather than talking about we, the trust, it's me, it's I'm the person using Twitter, and in some ways representing this trust, but we are human. So social media allows you to become a bit more, sort of bring some more personalities out. And the second one, it actually allows better ways to connect with communities. People nowadays have got mobile phones, people have got access to sort of lower cost tablets and computers. So it's using this sort of technology to actually connect better with people. Again, sharing information, it's a two-way sharing as well. Rather than we know what's best for you, here's some stuff that you need to do. It's actually listening to communities. So sharing through social media and social technology is 2 ways. And also this getting things done. This is a term that was bound. It was in flavour a couple or 3 years ago, perhaps a bit more. Getting the technologies, the phone, the collaborative software, the open source software allows people to really work more efficiently. So rather than when you're introducing technology into teams, into an NHS, they may start thinking, oh, this is more stuff that I've got to, not only have I got to do the usual day job, now you want me to run a Twitter, now you want me to run a blog, now you want me to do an email newsletter. I've got all this other stuff to do at the same time. Well, actually what's happening is these technologies and this piece of software actually is allowing people to be more streamlined, to work more efficiently. So instead of doing the typical press release, actually sometimes you can stop the old traditional ways of engaging and putting information out and shift that online, shift that to Twitter, shift that to Facebook or whatever service you're using, actually can help you to get things done more smartly. Okay, so last 2 points. So the social web is allowing us to actually engage better, new ways of engagement, new forms of engagement, and also it's a way to enhance learning both within an organisation, but learn from communities themselves, treat them as experts. There's lots of learning that can be done through social media. So that's it wasn't a presentation, yeah, so have fun, talk, share. Thank you.